Hello everyone, welcome to See and Perceive section. This session is about Sitz Bath. The topic is arranged under following headings: Introduction, Purposes, Indications, Contraindications, Points to remember, Articles required, and Steps of procedure. Let us begin with Introduction. A Sitz Bath is a method of applying warm bath to the pelvic or rectal area by sitting in a tub. It is also known as hip bath. It cleanses the perineum. This is the space between the rectum and the vulva in female or scrotum in male. It can also provide relief from pain or itching in the genital area. It is a local application of moist heat to the pelvic organ. Temperature of water should be 105 degrees to 110 degrees Fahrenheit, or we can also use lukewarm water as it is comfortable for the patient if we do not have bath thermometer. Duration of bath is 15 to 30 minutes or as much tolerated by the patient. Purposes: to aid the healing process of perineal wounds by cleaning it and to wipe off discharge and debris, to reduce the pain and discomfort, to reduce swelling and irritation, to increase circulation by vasodilation, to promote relaxation, to relieve pain in retention and painful urination. Indications: after surgery in the anorectal area, after incision in the perineum, example episiotomy, swollen painful hemorrhoids. Contraindications are diabetes, peripheral vascular diseases, impaired peripheral sensory function, immediate post-hemorrhoidectomy. Points to remember: maintain the privacy of the patient. Ensure appropriate level of water and its temperature before allowing patient to sit. Size of tub should be appropriate. Wash hands before and after the procedure. After finishing Sitz Bath, dry the perineal area. If a patient is on analgesics, then he or she can experience lightheadedness and drowsiness. If patient has received epidural anesthesia, be sure that complete sensation has returned before using a warm sitz. Articles required. The articles used in the procedure are shown in figure. Sitz bath basin, warm water in jugs, temperature 105 degrees to 110 degrees Fahrenheit or 40 to 43 degrees centigrade, or lukewarm as comfortable for patient. Medication if ordered, clean gloves if needed, towel, cotton pad for drying, kidney dish for waste. Steps of procedure. Pre-procedural steps. Check the physician's order and nursing care plan. Identify the patient. Assess the patient's condition, pain level, and ability to ambulate to the bathroom. Wash your hands. Intra-procedural steps. Add required quantity of ordered medication, example betadine, into Sitz bath basin, potassium permanganate, etc. Fill the basin with warm water at temperature of 105 to 110 degree Fahrenheit. Keep basin on a low stool or potty chair or toilet bowl with toilet seat up. Assist patient with removal of any dressing or peri-pad and position and assist to sit in the Sitz bath basin. Place the towel on patient's thigh and cover the shoulders with sheet to protect from chills and exposure. Do not leave the patient unattended during the procedure. Instruct the patient to contract and relax the urethral sphincter while taking Sitz bath, like urine holding. Allow the patient to sit for 20 minutes. Then assist with drying and applying dressing or peri-pad as required. Discontinue the procedure if any adverse effects like dizziness, weakness, discomfort, accelerated pulse rate, or pallor occurs. Help the patient out of the tub when the bath is completed. Assist patient back to bed and instruct to stay in bed for 20 minutes hip elevated. Clean and replace all the reusable articles. If the basin is to be autoclaved, arrange for it. Wash your hands with soap and water. Post-procedural steps. Document tolerance of procedure, pain, and appearances of perineal area or wound area. Waste management. Soiled water should be drained in toilet. Peripad and tissue used for wiping off perineum should be discarded in yellow bag as it will be contaminated. Thank you.